In the midst of traditional healthcare innovation today, a lot of people are asking, why digital health? There's two responses to this. At the macro level, when you think about what's happening with the incidence of chronic disease, certainly the prevalence and its cost around the world, and at the micro level, what's happening with the patient on a day-to-day basis. They have to manage their medications, their exercise, diet, etc. And then they have to take that data to their healthcare provider who has to make sense of it in, say, a 3 or 4 minute office visit, perhaps once, twice, thrice a year. Things just don't work. And when we look at that equation, this kind of collision of these two problems, one thing jumps out, which is patient engagement. And perhaps we dare say, is the blockbuster drug of the 21st century actually the engaged patient? So when you think about it, look at what happens in healthcare today. I have patient engagement and the frequency by which they engage, and I have the intensity or cost of that. So if they have chronic pain, they pop an Advil every day, but it's not a big deal, right? At the same time, if they have surgery, hopefully they don't do it often, but when they do, it's a big deal. The issue today with chronic disease is they're all stuck here in this upper quadrant. Diabetes, congestive heart failure, these are things that patients should manage more often, but they're not, so they end up in the ER. And when you think about the value proposition of digital health, it takes this cost basis and it shifts it down here. So in many ways, digital health is there to transform outcomes for chronic diseases.